Hi, Mike Gibson, Pam Taub with an end of the year wrap up of what's going on in prevention. Exciting year, Pam, right? I mean, a lot of things happening in the LDL side, the Lp(a) side, and of course on the obesity side. Let's start off with Lp(a). What was hot this year?
Well, what's really exciting is LP little a is now an established biomarker for atherosclerotic cardiovascular disease. And we have multiple drugs in phase 3 clinical trials. But we're also getting more novel technologies in the LPA lowering space, such as the silencing RNA compound lepodisiran, and we had some data presented at AHA on its potent LPA lowering. What I find exciting about this compound is it could potentially be dosed every 6 months, similar to inclisiran, which we already have on the market, that's given every 6 months. And these silencing interfering RNA compounds really have very little side effects. So that's also very exciting. So we're going to have a lot of options for LPA lowering.
That's great news. I mean, to put a fine point on it, I think it was about a 97% lowering at the highest dose. Pam, I have about a 2 to 2.5 times higher Lp(a) than I should, and for someone like me, that is great news. Anything else going on the Lp(a) side? I mean, there's also an oral drug, right? That
Yeah,
was
there's an oral drug which the data was presented, and then let's not forget we have two drugs in phase 3 trials. We have pelacarsen and we have olpasiran, and those are really also pretty well tolerated drugs. Pelacarsen is once a month, olpasiran is every 3 months, and so we're going to have now multiple options for LPA lowering that I think will be FDA approved within the next couple of years.
what about on the LDL side?
Well, the LDL side is also very exciting. We have an oral PCSK9 inhibitor that is in phase 3 clinical trials. And what's really exciting to me about this trial is it also includes a subset of patients that we classify as high risk primary prevention. They have evidence of atherosclerotic cardiovascular disease, but yet have not had an event. So that will be very interesting to see how a PCSK9 inhibitor that lowers LDL about 60% can impact outcomes in these patients. We also had great data from the CLEAR Outcomes study in bempedoic acid presented at ACC in 2023 that showed a significant reduction in cardiovascular events with an agent that is really well tolerated and can be given to patients who are statin intolerant. And what was also very exciting is that there was a sub study looking at the high risk primary prevention cohort from Clear Outcomes that was published in JAMA that showed an even greater benefit and even greater absolute risk reduction in these patients. There was even an all cause mortality benefit that we saw in this high risk primary prevention group. One of the big takeaways for me is we're going to be studying the high risk primary prevention group a lot more. We have a lot of therapies for patients with established atherosclerotic cardiovascular disease, but the next frontier is the patients that are very high risk. Now we're going to have a lot more options. And bempedoic acid has had an interim update to their label where they've added that it's not on top of maximally tolerated statin therapy. That's been removed. That it's that you can just be on any statin therapy, and it could be very, very low dose statin, and then you can add bempedoic acid. I think this interim label is really going to pave the way for FDA labeling of statin intolerance because these patients really have very high LDLs. It's an unmet need, and we have to do better for patients that are statin intolerant.
Absolutely. And of course, you were discussant regarding genetic editing to lower LDL. What were your thoughts about the Verve compound?
I think it's a very exciting concept of, of gene editing for lipid lowering. The data that was presented showed that when you gave a small number of patients this gene editing compound, that there was about a 55% reduction in LDL. There were some safety signals. There was one patient that had a myocardial infarction a day after the compound was given, raising the issue of, is there something about the delivery mechanism of the compound that's causing an inflammatory reaction that's maybe causing unstable plaque? I mean, it's very early. I still think it's an exciting technology, and I think it's a technology that's going to be part of our armamentarium. I don't really think it could be just a standalone technology with just 55% lowering of LDL.
And of course, I think some of the biggest news this year comes in the cardiometabolic obesity space. Wow, just wow. I mean, talk to us about the SELECT trial.
Yeah, I think that cardiometabolic is where we're at. I don't think it's accurate anymore to say preventive cardiology. I think it's really, we need to say cardiometabolic and really encompass both the endocrine system, the renal system, and the AHA even came out with a great presidential statement talking about how we really need to think about things in a holistic manner and not just cardiac issues in isolation. And some of the trials, such as SELECT, really highlight this. So in SELECT, we saw a reduction in cardiovascular events in patients with obesity. And this is a game changer because now we really need to start thinking about obesity as a disease that encompasses cardiovascular disease, just like diabetes. We used to think about diabetes as an isolated disease, but now we appreciate that diabetes is under the umbrella of cardiovascular disease. And similarly, we're going to start thinking about that with obesity. We also had some exciting data from the STEP HFpEF trial that showed in patients that have heart failure with preserved ejection fraction that semaglutide could really not only reduce weight, but also improve quality of life metrics. So I think the GLP-1 and GIP-1 and all of the newer drugs that are coming, including the triple agonists,
Mm.
are going to transform the cardiometabolic space.
People have said, well, if you lose weight, you're going to feel better and maybe have better exercise tolerance. But it may be beyond that. I mean, Viviani Kitty has shown that, really when you reduce weight in people who have banding, you improve microvascular dysfunction. And likewise, some of HFpEF may have a component of microvascular dysfunction. So it may be more than just, shedding some pounds, you feel like you can get around a little easier. There may be some really important physiologic explanations for this benefit.
Yeah, and we know from a pathophysiological perspective that there are so many alterations that occur with obesity, especially increased inflammation and abnormal adipose tissue, especially the visceral adipose tissue. And inflammation drives so many diseases like atherosclerotic cardiovascular disease, cancer. So obesity from a mechanistic perspective isn't just about the weight and the extra pounds. There's a lot of pathological derangements that are occurring in patients that are obese. And we need to be using drugs such as the GLP-1 receptor agonists to not only shed the pounds, but really address the underlying derangements.
Yeah. Well, 2023 was a great year, but what's coming up in 2024?
We have a lot of exciting data that's going to be presented in 2024. One of the trials that's very exciting is the FLOW study with semaglutide in patients that have chronic kidney disease. That study was stopped early because of benefit. So it's going to be another game changer because we're going to now be looking at GLP-1 receptor agonists as agents for renal protection. We already know that SGLT2 inhibitors have renal benefits. So now we will also have data from a GLP-1 receptor agonist. So that's very exciting. The other data that we're all looking forward to is data from the Surpass cardiovascular outcome trial that's looking at the impact of tirzepatide on cardiovascular outcomes. And we also have a lot of trials that are going to be presented in the future on LPA lowering. So the Horizon program with pelacarsen, that has completed enrollment. So we're all looking forward to having the first readout on LPA lowering and how it impacts cardiovascular outcomes. So I have to say that my field is exploding. There's so many trials that are going to change our clinical practice in 2024 and beyond.
You keep this up, you're gonna put us out of business as interventional cardiologists, Pam.
Well, that's the ultimate goal
It
is prevention
it
and
is.
preventing
It is.
intervention.
It is. What I talk about with my kids, genetically, the big question becomes, not how low, but when you should start getting low. So, another big question becomes, how soon will we be starting some of these, uh, amazing drugs in life? So, well, Pam, thanks for joining us. Thanks for sharing your perspective. And I want to do this with you again next year. It's hard to believe it'll be even more exciting, but just may be.
Definitely look forward to going over some of the new data that's going to be presented in 2024.
Great. Thanks for joining us, and thanks to all of you out there for joining us here today.